Susie. I am coming on today to tell you a little bit more about hormones and hormone testing. And this is one of the most frequently asked questions that I get here at Bento is, when do I need to test my hormones? And how do I go about doing it? And what do I even need to get tested? So yes, the answer is that it's perfectly normal and fine to get your hormone levels tested, no matter sort of what reproductive life cycle or stage that you're in. It's a good thing to know more about your body and get some insight so that you can feel informed and then make really informed decisions when it comes to your health. So the more you know, it isn't going to hurt you. All right, so now that we have that out of the way, what you want to do is go to your health provider, whether it's your OBGYN, your family doctor, if you see a nurse practitioner or PA, functional medicine doctor. That's the first place you're going to go. And I do recommend getting blood work over the urine or spit test, especially when it comes to hormone testing. I think nothing really compares to having the blood work drawn. It's really probably going to be the most accurate, so I would start there. And then you want to make sure that they're going to do it. And a lot of physicians, traditional ones, tend to push back a little bit when it comes to measuring certain hormones, especially for women who are in their childbearing ages and might want to know a little bit more about hormone levels for their fertility status. So it's okay to advocate for yourself, and if that doctor or provider is still pushing back, then maybe it's time that you look for someone new who's going to listen to sort of what you're asking for or what you're hoping to get out of your healthcare provider. So that's going to be sort of the first step you're going to do. And then you want to call your insurance company. And the reason why you want to call your insurance company is because you don't want to be hit with a massive bill after getting these labs drawn. So make sure you call your insurance company and you find out what laboratory you are capitated to. So this could be a LabCorp, a Quest, or a hospital lab if your insurance is under a specific hospital network. So you want to find that out. And then the second thing you want to do when you call your insurance company is find out what diagnostic code this blood work needs to be under. So that's going to be an ICD-9 or ICD-10 code, and you want to find out which one the provider who's ordering the labs on you for needs to code the blood work for, so that you are covered. All right, so those are the steps leading up to everything, but now you need to know what you're supposed to be getting tested, and I'm going to tell you right now. So the first thing that we want to look for on women is a fasting glucose level. This is going to give us insight into the hormone known as insulin. It's produced by the pancreas, and it plays a major role in sort of the breakdown of food, our blood sugar levels, and our metabolism. So it's a really critical hormone that doesn't get talked about enough in terms of women's health. So that fasting glucose might give us insight into your insulin levels. Then we want to talk about the sex hormones. So those are going to be estrogen for women. You want to have your estradiol levels drawn, and then your estrogen levels drawn. So really, really important hormone. It is produced primarily by the ovaries in women, and it's going to give us insight into your menstrual cycle and your reproductive health. Then we want to know your progesterone levels. So progesterone plays a critical role in the second half of your menstrual cycle. It's the hormone that's needed to support a healthy pregnancy, and it comes into play after ovulation. And then we'll talk about when to get your hormone levels checked at the end of this. So far we have the fasting glucose level for insulin, we have the different estrogen levels, and we have your progesterone. And then you want to have your thyroid hormone levels drawn. So there are going to be 3 different hormones you want checked here. And this is your T3 and T4. Those are the hormones produced specifically by your thyroid gland, which sits in the base of your neck. And your thyroid is critical for your overall metabolism in the body, and it's important for energy and temperature control, weight. So really, really important hormones for women to know the function and the health of your thyroid. So TSH is the thyroid stimulating hormone, and this is found, actually, it's secreted by the pituitary. So this is not secreted by the thyroid, but you wouldn't know that by its name. And your TSH is the hormone that controls your thyroid itself. So if the TSH level's off, it's going to impact the thyroid, which can impact your T3 and T4 levels. So those are the three you want to get checked there. And then you want to have a serum cortisol level checked. And your cortisol level is known as the stress hormone. So this is something, it's produced by the adrenal glands, and it's something that women and probably men everywhere deal with. We all have stress, and we need to know if your circulating cortisol levels are really, really high, and if that's leading to some type of hormone imbalance. And then last but not least, testosterone. So this is an androgen. It is one of the male sex hormones, but we as women also have testosterone. So we want to get this checked because if it's elevated, it could be indicating something like polycystic ovarian syndrome. So those are like the main hormone labs we want to get drawn. Now, if you are trying to get pregnant, there are a couple other hormone levels that we want to look at. The first is prolactin. This is really, really important. It can impact your pituitary, and it can impact your ability to get pregnant. So if something's thrown off with your prolactin levels, we want to know about it. And then we have your follicle stimulating hormone, or your FSH. This comes into play with ovulation. So follicle stimulating hormone is what helps produce and grow a mature egg during ovulation to prepare it to be released so that you can hopefully get pregnant. So we want to see normal FSH levels. We know that if it's really, really high, then your body's working overtime to produce an egg. So something might be going on there. And then also we want to look at your LH levels. We want to make sure that they're low in the point of time that you're getting your levels checked. We'll come back to that. And then we want to get your AMH levels drawn. Now, AMH is really used by reproductive endocrinologists and infertility specialists as a biomarker for sort of where to put you on or what dose to prescribe your IVF and fertility drugs. So if you're doing an IVF cycle, it gives us a base for what protocol that you're going to be put on. This is not used as a predictor of fertility. So just know that going in, and AMH levels can change month to month. So your anti-Müllerian hormone level is interesting biomarker for ovarian reserve. However, it's not a predictor of fertility, but if you want to go ahead and get it tested, you can do that. Okay, so those are the only other ones I would really add on for fertility. That's it. Now, when do you want to get your hormones tested? It's really, really important that we get this tested at the start of your menstrual cycle. So between cycle day 1 and cycle day 3. Cycle day 1 starts with the first day of full flow of your period, so not the spotting days, but full flow. Typically, we like to get these levels drawn on cycle day 2 or 3, and that's when your hormone levels are at their baseline, and things are should be even and where we want them to be. So if something's too high or too low for this stage, we know is there some type of hormonal imbalance that we need to address. All right, so those are my hacks for hormone testing. I hope you got a lot out of this, but feel free to comment, DM us any of your questions. All right,